Hello, my name is Hallie Bass, and I'm a retired nurse practitioner. I am making a series of short, informative videos on some health topics and issues. Today's topic is the dreaded Pap test. Most women preface this event by saying, "I hate this. How do you do this?" And I reply, "I've been a nurse for many years and have seen loads of bums. It's just my job, and my job to make you feel okay about it." So what is a Pap test? We remove a sample of cells from the cervix, which is the opening of the uterus into the vagina. Pap tests start at age 21 and go to age 69, according to the provincial guidelines in the province of New Brunswick. You have 3 tests at 1-year intervals and then can move to a 2 to 3 year schedule if you have no problems. We test to prevent the development of cancer of the cervix and to detect changes in the cells that are usually related to human papillomavirus, or HPV. We can diagnose cancer of the cervix and precancerous areas also. If these changes are found, you are sent to a gynecologist for further examination, perhaps treatment and follow-up. We use an instrument called a speculum, which is inserted into the vagina just part way, so we can visualize your cervix and take a sample. I use a plastic device with a light source and a sleeve to protect from infection, and I use lubricant to ease the insertion. I explain what I'm doing as we go along, so there are no surprises. It is smaller than a penis. How to prepare? Well, lots of stuff. No sex, douches, intravaginal medications, suppositories, vag sprays or powders, contraceptive inserts or creams for at least 24 hours, and if you can make it 48 prior to your test. Try not to be having your period. Lots of blood can make it hard to see the cells and get a good sample. Mid-cycle is usually best. Pee before an empty bladder is more comfortable for you. You don't have to shave. Legs, crotch, makes no difference to your healthcare provider. Know the date of your last period. Any birth control methods? Have you had the HPV vaccine? Are you pregnant? Are you menopausal? Or are you on hormone replacement therapy? We usually have to fill in that information on the requisition. Wear comfortable clothing so that you can remove the bottom half. You can bring some baby wipes or peri wipes. I give them to everybody, but most providers don't. For me, it's a courtesy. How many times have you looked around for a Kleenex or something? I usually do culture swabs or STI swabs, sexually transmitted infection swabs, on my young women, all prenatals and sexually active persons who request or need it. Many people request an STI swab at the time of their exam. For results, I call all my people, but I don't know of many providers who do. I don't subscribe to the no news is good news idea. I've seen things missed. So if your provider doesn't tell you, ask. Also ask about the testing interval. Is it going to be 6 months, a year, 2 or 3 years? I even give a ballpark date a lot of times. "Hi, this is Hallie. Your Pap test was normal. Your next one is due between June 2022 and June 2023. Make sure that your contact information is up to date. Everybody has cell phones now and there's no directory. And I am not the amazing Kreskin. And my clerical staff can't take all day to track you down. I don't want to have to call your mom to get a number for you, nor does public health, if you have the great big C, which is chlamydia, or another STI. This is also an opportunity to talk about contraception, safe sex, your general health, all those things. So breathe in, breathe out. It's easier to relax your muscles when you are not breath holding. I hope this little session is informative, and I hope it helps you the next time you go and have a Pap test. Here's a couple of limericks to send you on your way. So we have to check out your vagina. A hard word to rhyme, like Regina. We'll have a look-see, check for clap, HSV, a stress test, but not for angina. And number 2, well, it's time once again for your Pap. Turn your phone off and don't take a snap. Don't get all existential. It's all confidential. Spec goes in, swab's all done. That's a wrap. Thank you very much for your time. See you next time.